Hello and welcome to Radiant PT, where we discuss all things pregnancy, childbirth, and postpartum. My name is Caitlin Sue. I'm a doctor of physical therapy specializing in pelvic health. This is evidence-based care that takes into account the research, my experience working with hundreds of women, as well as most importantly, you, your preferences, your lifestyle, your body, your intuition. Let's dive in. Today we are talking about DRA. What does it mean? What does it look like? What's normal? When should you seek out treatment? And what options are available to you? DRA stands for Diastasis Rectus Abdominis. Diastasis, also pronounced diastasis, means a separation. Rectus abdominis is one of your abdominal muscles. This condition also goes by the name DR or just diastasis recti. Let's look at the anatomy so we can kind of see what's going on. The abdominal wall has 4 layers of muscles. The purpose of the muscles are to stabilize the low back and pelvis, move the trunk, and manage pressure within the abdominal cavity. The deepest layer is the transverse abdominis. The fibers of this muscle run horizontally, and it functions like your built-in belly band, corset, or back brace. This muscle draws the belly in and has a big role in stability. Next, we have 2 layers of obliques whose fibers run diagonally in opposite directions. You have your internal obliques and your external obliques. These muscles allow you to side bend and rotate the trunk. Finally, the most superficial muscle is called the rectus abdominis. Its fibers run vertically in 2 distinct bundles with connective tissue in between called the linea alba. The rectus allows us to flex the trunk forward or control against extension backward. This is what we think of as the six-pack muscle, and yes, everybody has one. During pregnancy, your belly has to expand to make room for the growing uterus and baby. One area that stretches quite a bit is that linea alba. This is a completely normal adaptation of pregnancy that happens in up to 100% of women carrying a baby to term, according to the research. So if you're pregnant, you are more than likely going to have one during pregnancy. During pregnancy, a DRA might not be super visible, but if it is, it might look like coning or a torpedo effect of your belly. This will be noticeable during crunching type movements, like when you're getting up from lying down, or even leaning back to wash your hair in the shower. So why is this a big deal? Well, during pregnancy, if you do have a separation and you don't know how to modify how you move or modify how you exercise, then you can risk making that separation worse and harder to recover from postpartum. Other factors like genetics affecting your connective tissue quality, hormones from things like breastfeeding, and just how you're carrying your baby during pregnancy can also have a role. Unfortunately, many women are told at their one and only follow-up appointment at 6 weeks postpartum that because this condition is normal, that they either need to just wait for it to resolve on its own or that there's nothing that can be done. But postpartum, we see about 40% of women will still have an unresolved DRA after tissue healing has occurred at about the 6-month mark. Now these women are lifting their babies in their car seats, returning to exercise, and just not moving in a way that allows the abdominal muscles to heal. And a DRA is also correlated with other issues like back pain and leaking urine in many women. Postpartum, a DRA might look more like either a gaping inward or a puckering outward along that midline of the linea alba. If you see this, it indicates that you are not generating enough tension in that connective tissue to withstand the intra-abdominal pressure that you're creating from that movement. This is a warning sign. You need to either change how you're recruiting the muscle, change the pressure that you're creating via your breathing, or modify the movement or the exercise. For example, if you are trying to sit up or crunch up to get yourself out of bed and you see doming, you need to do one of 3 things. You need to learn how to engage your transverse abdominis or deep core muscles to improve the tension in that connective tissue, or you need to exhale to decrease the amount of pressure that you're generating in your intra-abdominal cavity, or you need to log roll to get out of bed the same way that you did during pregnancy. We modify the movement so that you're not engaging your abdominal wall in the same way. In PT, we help you modify and troubleshoot movements and exercises that you want to get back to doing. The idea is to build back the strength and the coordination to be able to do them safely without straining at the muscles. In rare cases, a very severe DRA or one that involves a symptomatic hernia may require something like surgery to repair. But in most cases, PT is a really safe and effective way to help regain the normal function of your core so you can get back to doing what you want. If you have questions about DRA, please leave them for me below. There's lots to talk about, especially in regards to treatment strategies, so I might need to make a part 2 for this video. If you have enjoyed this video, please like it and consider hitting subscribe so you don't miss any of my upcoming content. Remember that these videos are always information and inspiration, not medical advice. Thank you so much for being here. I'll talk to you soon.